Let's start with whether we really might be at the end game of COVID, from where we go from pandemic to endemic. Dr. Gandhi, can you just explain what that means? Because I've heard that term endemic many times. I don't totally understand what it means, what it looks like, and how we'll know when we're there.
Yes. So these are very traditional infectious disease definitions, but essentially an epidemic means you have an undue burden of disease, more than expected. Well, what would we know that's more than expected with COVID? More than expected is people in the hospital, a lot of hospitals being flooded, people being really sick. And then a pandemic means that it's extended to multiple continents. And then what an endemic means is that it's gone down to a level where you live with it. And it's at such a level that it doesn't cause an undue burden. Everyone's going to have to decide what undue burden means for themselves as a country, of hospitalizations or disease. But I will tell you, and I'm sorry to say this because I think some people don't think this, but we're not going to eradicate COVID because of some very key pathogen properties about it. It's very transmissible. It looks like another bunch of other respiratory viruses. You can spread it even when you don't feel sick, and it also has some animal hosts that it sticks in. So all of those infectious disease reasons means we can't get rid of it, we can't eradicate it. That means getting rid of. But luckily, once it's endemic, it's kind of one of our other respiratory illnesses that we live with, and life should go back to normal. And I think we're getting there in many places.
So how do we know when we're there? Because I'm just looking at the COVID cases, et cetera, as of September 29th. This is over a 2-week period. The number of cases is down 26%. This is nationally. The number of hospitalizations down 16%. But the death numbers, which tend to, I guess, lag, I don't know that I'm not exactly sure, but for the past, I don't know, several weeks, every time I look at the death number, it's on the plus side. It's gone up 7% over the past 2 weeks. So what does that tell you?
So we're not quite there in the United States yet. And everyone has to define, again, what it works for their country. There's about 100 deaths a day from influenza. So some people have said, okay, once you get to 100 deaths a day, averaged out over the year, everyone's going to decide where
we're at about 2,000.
Yeah, so there's still very high deaths and hospitalizations in some regions. I live in a state, California, that we have very low hospitalizations and deaths. You could argue that we're endemic here in California, but we're still masking and have restrictions. Denmark decided at a 74% vaccination rate to open up society. Norway decided at a 67% vaccination rate. Portugal decided at a 80% vaccination rate. And then finally, Ireland on October 22nd will open at around an 80%. So every country's deciding for themselves. We have to come up with a definition in the United States so that we're not in endless restrictions, endless masks, and make that decision. And it shouldn't be political, like a blue state says this and a red state says this. We should come up with some definitions that make sense.
What about that? So I'm going to get to Dr. Kulldorff in 1 second, but aren't we over 70% vaccination rate here in the country? And that's not even including the 42 million people who have had COVID and, have natural immunity. And they may also be part of the vaccinated number.
So you're right. There's a lot of overlap. If people have been sick, they could have gotten vaccinated. We don't know what our real seroprevalence rate is. Yeah. It could be as high, it could be very high. I'll tell you one thing about, how do we decide or how do we know? Places like California, I could say we know because our hospitalizations are low, absolutely manageable. I work in a hospital. I see people across the street, and we have very low numbers. And we have a higher vaccination rate than the national, which is actually 64.4% one dose. It depends on if you're dividing it in over 12, over 18, and over 65. The CDC provides different definitions. We have to decide as a country when we feel like the burden of disease is not high. And the problem is we're looking at cases. We're looking at, like, there's been numbers flown around, like when we're less than 10,000 cases. That doesn't make sense to me because cases, the reason we detected cases, when we call them cases, they're actually, you can feel totally well, you're asymptomatic, was because you didn't want it to spread to someone else. But those aren't traditional infectious disease definitions of disease. disease means you feel unwell. So I think we have to look at hospitalizations, because we don't know how many people have colds with COVID. We're not tracking that. Let's look at hospitalizations, decide when it's a number that we can all live with, like we live with influenza in the hospital, we live with RSV, and then we have to lift restrictions. And when do I know that we're there in California, but I'm not a policymaker.
And when you say restrictions, what do you mean?
Well, right now we're still masking in California and San Francisco inside, and many people are masking outside. I went to a outside theater. I was so excited to go to the theater, and then I had to wear a mask outside. And just 2 days ago, and I actually said to the person, I'm an infectious disease doctor, and I don't think we have spread outside. And then they said, wish everyone was an infectious disease doctor.
And then they said, you want to kill grandma. And you were like, what? Wait, what?
My nuanced views and on lifting masking has gotten me into trouble.
I know. I've seen that. But I've seen you also be brave. And as I said in the intro, you'll push back against either side. You won't be totally beloved by the people who hate mandates, but you won't be totally beloved by the people who love them either, which I like.
I get it from both sides. So that's where I am right now.
But I appreciate that. So Dr. Kulldorff, what are your thoughts on when we'll know it's time, that we've gotten to endemic instead of pandemic or epidemic, and it's time indisputably really to take off masks and get back to what we used to know as normal?
Well, Dr. Gandhi is correct that we cannot eradicate COVID. It will be with us forever as an endemic disease. What happens is that almost all of us are going to get infected sooner or later. And as long as there are susceptible people who can get the disease, then we have a problem that we have to deal with. And there's also a seasonal pattern, which is different in different parts of the world, including different states. So we have, for example, seen a summer wave in the south, which we had last summer as well. So I think we can expect a winter wave in the northern parts of the US. We don't know exactly the magnitude of it, but there are some states that have had very few cases, for example. So whether the time we reach the endemic state will vary geographically. What is key thing now is that as we're approaching the winter season, it's very important that the older people who have neither had COVID, because if you had COVID, you have good natural immunity, it's better immunity than from the vaccine. So if you've had COVID or if you're vaccinated, that's good. But there's still older people out there who have not yet been vaccinated and that have not had COVID. And as we now approach the winter wave, they are at high risk. So the most important thing to do at this point to minimize death is to convince older people, somebody who's 77, somebody who is 67 or 87, or even 97, to get vaccinated if they haven't already had COVID and they haven't already been vaccinated. That's the most important thing we can do in terms of the public health right now. Mm-hmm. And it's not enough just to say that these vaccines are freely available. We have to really help educate people about the importance for these people to get the vaccines. And even though, as with any medical intervention, drug or vaccine, there are some risks with vaccines. We know about those. At least some about them. There are things we don't necessarily know yet because that takes 2 or 3 years. But if you're in this age bracket, the benefit of the vaccines greatly outweigh any small risk with it. So the benefit cost or the benefit risk ratio is very favorable. So it's a no-brainer, I think, for people in these ages to take the vaccine. So I think that is the most important thing we can do now